So hello everyone. So finally INI-CET is over and one exam is out of the way. And now we are on to the final steps of the NEET PG exam 2025. And today I, Dr. Manav Gupta, who is currently doing MD Radiodiagnosis from Maulana Azad Medical College Delhi, who got a rank 14 in INI November 2024 and rank of 111 in NEET PG 2024, is going to discuss the final key for INI-CET May 2025. So this video is very important for all of the NEET PG aspirants. As we know, in NEET PG, there are a few or sometimes too many repeat questions from the previous INI asked. So here I'll try to accommodate all the questions which have come in this INI and I'll try to provide the answers for the same. And I hope you all the best for the results of INI-CET, and let's go. The first section is for psychiatry. So the first question is, a 40-year-old woman with bipolar disorder is planning for pregnancy. Which of the following drugs must be avoided due to the possibility of neural tube defects? The options are A. Valproate, B. Oxcarbamazepine, C. Lamotrigine, and D. Levetiracetam. The answer for this question is A. Valproate. Now moving on to the second question. The second question states that which of the following drugs are used in the management of acute mania? The options are 1. Lithium, 2. Valproate, 3. Haloperidol, 4. Amitriptyline, and it is a multi-correct option. And the correct option is lithium, valproate, and haloperidol. So the third question, a patient with schizophrenia says, Lord Hanuman was celibate. I am celibate too. So I am Lord Hanuman. Which thought abnormality is present in this patient? So you can see here as well that Dr. Praveen is teaching this topic in his mission videos as well. And also I'm happy to announce that taking only mission videos into account, it will cover around 80% of the MCQs which have been asked in the INI-CET, covering only the mission videos, leaving aside ENDs, TNDs, revision videos, and even the main videos. So we account these videos as well. Around 90% of questions were directly from the videos of Cerebellum. So we had a great strike rate, and also the INI mock, which was conducted by Cerebellum, had various multiple choice correct questions, various fact-based questions, which are similar to the questions asked in the INI in the May 2025. So it was a great success for the Cerebellum app. So the options for these questions were A. Autistic thinking, B. Verbigeration, C. Neologism, D. Loosening of association. And the answer for this particular question is A. Autistic thinking, which has been greatly taught by Dr. Praveen Tripathi in his mission videos lectures as well. So now coming to question 4. All of the following statements are correct except. The options are A. Opioid withdrawal is rarely fatal. B. Buprenorphine can be used for the management of opioid withdrawal. Option C. Flumazenil is used for the management of long-term management of alcohol dependence syndrome. Option D. Cannabis withdrawal is associated with minimum physical symptoms. And the correct answer for the same question is answer C. Flumazenil is used for the management of long-term management of alcohol dependence syndrome. So now coming to question 5. Which of the following statements is incorrect? The statement A is alcohol in low dose causes brain stimulation and in higher dose causes brain suppression. Option B, cannabis use can result in self-driven repetitive behaviors. Option C, opioids are very effective analgesics. Option D, volatile inhalational agents are mostly toxic to humans. The correct answer for this question is A, alcohol in low dose causes brain stimulation and in higher doses causes brain suppression. So moving on to the next question. Question 6, which of the following is not an ICD-10 diagnostic criteria for depression? The options are A. Low energy levels, B. Low mood for most of the day, C. Loss of interest in pleasurable activities, and D. Low self-esteem and confidence. The answer for the same is D. Low self-esteem and confidence. And you can clearly see the same thing taught by Dr. Praveen with the help of a mnemonic in the mission videos. The next question, question 7. Which of the following new psychoactive agents results in rapid onset of action in the management of depression? A. Cannabinoids, B. Ketamine, C. Bupropion, D. Mephedrone. And the correct answer for the same is option B. Ketamine. So now coming to the INI-CET Radiology Recall. The question 8 is H sign or Honda sign is seen in which of the following pathologies? And the options are, the image was given and the options are A. Multiple myeloma, B. Sacral insufficiency fracture, C. Acute osteomyelitis, and D. Bone marrow edema. The answer for the same is B. Sacral insufficiency fracture. And another question, question 9. The eye of the tiger sign with an image was given. Is seen in, and the options are A. Wilson's disease, B. Krabbe's, C. pecan, and D. Huntington's chorea. And this has been taught by Dr. Zainab in her mission videos as well. We can clearly see in the screenshot that the eye of the tiger sign is seen in option C, pecan. Question 10th. Based on the provided X-ray image, identify the type of thyroid malignancy. The X-ray image was provided and the options were A. Papillary carcinoma, B. Hurthal cell carcinoma, C. Follicular carcinoma, and D. Thyroid lymphoma. And the answer for the same was answer C. Follicular carcinoma. Now coming to the question 11, a child presented with seizure and CECT is done and the image is shown below. What is the diagnosis? The options are A. Tuberculoma, B. Neurocysticercosis, C. Brain abscess, and D. Cerebral metastasis. And the answer for the same is answer B. Neurocysticercosis. Now coming to question 12, a male patient with diarrhea since 8 months with shown CT finding showing ahostral appearance in the right colon. What is the most likely diagnosis? The options are A. Ulcerative colitis, B. Tubercular colitis, C. Crohn's, and D. Pseudomembranous colitis. And you can see Dr. Zainab teaching the same lead pipe appearance seen in ulcerative colitis in the mission videos as well. The answer for the same question is answer A. Ulcerative colitis. Question 13. Most useful investigation for localization of parathyroid adenoma, which is a repeated PYQ. And the options are A. System EV scan, B. USG, C. FDG PET, and D. MRI. And the answer for the same question is system EV scan. Now moving to the next question. Question 14. A 35-year-old patient presents with colicky pain and is diagnosed to have ureteric stone. Which of the following is the best diagnostic investigation in this case? The options are A. NCCT KUB, B. USG KUB, C. CCT KUB, and D. ureteroscopy. And the answer for the same is NCCT KUB. Now moving on to the next question. Now starting with ENT Recall of INI May 2025. The first question is incorrect statement in juvenile angiofibroma is A. Recurrent epistaxis, B. Unilateral nasal obstruction, C. Exclusively adolescent male, D. Biopsy done under LA. And the answer for the same question is biopsy done under LA is the wrong statement. Cochlear implant will not be done in the next question. The options are A. Otosclerosis, B. Congenital hearing loss, C. Fixed malleus, and D. Ototoxicity induced hearing loss. And the answer, it was a multiple correct question and the answers were A. Otosclerosis and C. Fixed malleus. Now moving to the next question, another multiple choice question. The question is stridor in a newborn is seen in. The options were A. Laryngomalacia, B. Subglottic stenosis, C. Papilloma, and D. Hemorrhagic polyp. And the answers for the same are A. Laryngomalacia and B. Subglottic stenosis. Now moving on to the next question. Pyriform fossa injured due to a fish bone. Now which nerve is damaged? And the options are A. Vagus nerve, B. Internal laryngeal nerve, C. Recurrent laryngeal nerve, and D. Glossopharyngeal nerve. And the answer for the same question is internal laryngeal nerve. Now moving to the next question. A patient is experiencing vertigo and vomiting while turning in bed. And now we have to make the diagnosis. The options were A. BPPV, B. Vestibular neuritis, C. Meniere's disease, and D. Labyrinthitis. And the answer for the same is option B. Vestibular neuritis. Now moving on to the question number 20. After an ear infection, a child had limb spasm and difficulty opening mouth. Now what is the diagnosis? The options are A. Tetanus, B. Meningitis, C. Sigmoid sinus thrombosis, and D. Vezzo's abscess. And the answer for the same question is answer A. Tetanus. Now moving on to the dermatology recall for INI May 2025. Now starting with question 21. A patient presents with a progressive and asymptomatic lesion over the neck as shown in the image. There is no systemic involvement noted. What investigations are to be done in this patient? It was a multiple correct answer type and the options are A. KOH, B. Skin biopsy, C. Chest x-ray, and D. HIV test. And the correct answer for the same is B and C, that is skin biopsy and chest x-ray TB workup. Now moving on to the next question. A biopsy of a patient with recurrent painful vesicular lesions and superficial erosions in the genital area as shown in the image. What is the best treatment of this patient? And you can see it has been taught by Dr. Srinivas in the mission videos as well. And the options are A. Acyclovir, B. Corticosteroids, C. Penicillin, and D. Azithromycin. And the correct answer for the same is A. Acyclovir. Now moving on to the next question. A patient came with history of transient genital lesions 2 weeks back, now presents with lesion on palms and soles. Which of the following investigation is used to diagnose the disease? And the options are A. KOH mount, B. Gram stain, C. Skin biopsy, and D. Serology. And you can see in the mission videos, it has been clearly taught by Dr. Srinivas that secondary syphilis is diagnosed, which is the answer in this question, is diagnosed by serology only. So the answer is D. Serology. Now moving on to the next question. Local side effects of topical steroids. Another multiple correct answer type. Among the following are answer option A, blue discoloration of skin, option B, atrophy, option C, acneiform eruptions, and option D, hypertrichosis. And the answer for the same is B, C, and D, that is atrophy, acneiform eruptions, and hypertrichosis. Now moving on to the next question. Another multiple correct answer type, and as we can see, many questions in this INI are multiple correct answer type, which was a similar pattern in our INI-CET mock in the cerebellum app as well. So the options are A. Epidermis can degenerate from hair bulge and sebaceous glands. B. Stratum corneum is the outermost cellular layer of skin. C. Epidermis is ectodermal in origin. D. Dermis and hypodermis are endodermal in origin. And the correct answer for the same are A and C. Epidermis can degenerate from hair bulge and sebaceous glands, and C. Epidermis is ectodermal in origin. The next question. A 24-year-old sexually active male presents to the outpatient department with complaints of painful urination and a thick yellow urethral discharge for past 3 days. He denies any fever, chills, or flank pain. He reports multiple unprotected sexual encounters in the past month. A urethral swab is sent for gram stain, which shows intracellular gram-negative diplococci with polymorphonuclear leukocytes. The organism is resistant to penicillin. Which of the following is the most appropriate treatment? And the options are A. Amoxicillin, B. Ceftriaxone, C. Vancomycin, and D. Tetracycline. And the correct answer for this question is ceftriaxone. Now moving on to the INI recall of anesthesia. The question is, which of the following drug is used to reverse the muscle relaxation caused by vecuronium? And we can see in the mission videos, Dr. Janvi has taught the same, that the neostigmine, which is the answer in this case, is used to reverse the muscle relaxation caused by vecuronium. Now, going to the INI-CET Microbiology Recall, the first question is, which of the following is not a dimorphic fungus? The options are option A, Histoplasma capsulatum, option B, Coccidioides, option C, Cryptococcus neoformans, and option D, Telleromyces marfani. And the answer for the same question is Cryptococcus neoformans. Now, moving on to the next question. A child presented with intense perianal itching. The image of the eggs was shown. Mother complains of seeing a thread-like worms in the perianal area. Scotch tape method was used to collect sample and show this X in the stool. Identify the organisms. The options are A. Ascaris lumbricoides, B. Enterobius vermicularis, C. Hymenolopsis nana, and D. Hookworm. And you can see here as well in the mission videos, Dr. Devyani in her microbiology mission videos has shown the exact similar image of the same eggs in her videos as well. And the answer for the same is Enterobius vermicularis. Now moving on to the next question, an image was given and it was asked which organism is this by seeing the test given in the image. And the options are A. Group B Streptococcus, B. Haemophilus influenza, C. Corynebacterium diphtheriae, and D. Clostridium tetani. And the answer for the same, the process shown was satellitism, and the answer for the same is option B, Haemophilus influenza. Another multiple correct question. Which protozoa does have more than 2 morphological forms? A. Naegleria, B. Acanthamoeba, 3. Trichomonas, and 4. Giardia. And the correct answer for the same is 1, 2, and 3, that is Naegleria, Acanthamoeba, and Trichomonas. That is option A. Now coming on to the next question. Which helminth maintains its life cycle by auto-infection? The option A, Strongyloides stercoralis, option B, Ankylostoma duodenale, option C, Ascaris lumbricoides, and option D, H. nana. So the correct answer for this question is option A, Strongyloides stercoralis. Now moving on to the next question. Kanagawa phenomenon in Vagatsuma agar is seen in which organism? Option A, Vibrio cholerae, option B, Vibrio parahemolyticus, option C, Shigella sonnei, and option D, Burkholderia pseudomallei. And you can see in her mission videos, Dr. Devyani has like written the same question which has been asked in this INI regarding the Vagatsuma agar, and the answer for the same is Vibrio parahemolyticus. So the questions are directly from the mission videos only. Now it is a match the following type of question. Column 1 has Elix gel precipitation test, Quellung's reaction, string test, and coagulase test. Column 2 has Streptococcus pneumonia, Corynebacterium diphtheriae, Staphylococcus aureus, and Vibrio cholerae. And the correct matching goes to option Elix gel precipitation test is seen in Corynebacterium diphtheriae, Quellung's reaction is seen in Streptococcus pneumoniae, string test is seen in Vibrio cholerae, and coagulase test is seen in Staphylococcus. The photo of an antibody was given and it was asked to identify the antibody by its structure, and the options were IgG, IgA, IgM, and IgE, and the correct answer for the same question was IgA. Now coming to another match the following questions. The column 1 stated southern blotting, northern blotting, western blotting, eastern blotting, and column 2 stated proteins, enzymes, RNA, and DNA. And the correct matching related to the southern blotting is used in DNA, the northern blotting is used in RNA, western blotting is used in proteins, and eastern blotting is used in enzymes. Now moving on to the next question. It was a multi-correct question again. We have to choose the true statements, and the options are A. Vidal test is positive in the first week of illness. B. Microscopic agglutination test is seen in Leptospira, is used in Leptospira. Wheel Felix test is used in typhus fever. Standard agglutination test is used in brucellosis, and VDRL is used for Treponema pallidum. And the correct answer for the same is that option B, C, and D are the correct statements. The statement A is the wrong one. Now moving on to the next question. Gram-negative diplococci organism resistant to penicillin. The Neisseria clinical image was given and the treatment of choice was asked. The options are A. Ceftriaxone, B. Tetracycline, C. Amoxicillin, and D. Vancomycin. And the correct answer for the same is option A, ceftriaxone, and it has also been taught in our mission video directly by Dr. Devyani. And the question is directly from the mission video, saying again that almost 80% of the paper was directly from the mission videos only. Now moving on to the next question. Which of the following methods are appropriate to identify different strains of same species of Mycobacterium tuberculosis? And the options were again a multi-correct question. The options were A. RFLP, B. Chromosomal mutation detection, C. Spogiliometer types, D. Miro analysis, Miro VNTR. And the correct option and the correct answer for the same question is RFLP, spogiliometer, and Miro analysis is used in the identification of different strains of same species of Mycobacterium tuberculosis. Now the next question. HIV positive patient presents with dysphagia or dinophagia. Esophagus shows plaques. What is the most likely organism? The option A is budding yeast cells with pseudohyphae. Option B, thin septal hyphae with acute angle branching. Option C, acid-fast bacilli. And option D, squamous cell cancer. And the answer for the same is option A, budding yeast cells with pseudohyphae. Now moving on to the next question. All are true about Toxoplasma gondii except option A, transmitted more in third trimester than first. B, releases cyst in stools that are immediately infective. C, can be grown in peritoneum of mice. D, infects most mammals and birds. The answer for the same is option B, release cyst in stool that are immediately infective. This is the wrong statement. Now another multi-correct question. Which enterovirus causes acute hemorrhagic conjunctivitis? The options are A. Poliovirus, B. Coxsackie A, C. Coxsackie B, and D. Enterovirus 70. And the correct answer for the same question is B and D, that is Coxsackie A and Enterovirus 70 causes acute hemorrhagic conjunctivitis. Now moving on to the next question. Question number 43. Patient presented with recurrent UTI. On physical examination, lower abdominal tenderness was seen and prostate examination was normal. Urine culture showed pus cells but no organism. What is the diagnosis? Option A, acute prostatitis. Option B, granulomatous disease. Option C, sterile pyuria. And option D, chronic prostatitis. And the answer for the same is option C, sterile pyuria. Now moving on to the biochemistry recall for INI 2025. The first question, 90 kg man after eating, then which enzyme intermediate will be active causing the weight gain? Another multiple correct question. The options are 1. Malonyl-CoA, 2. Acetyl-CoA carboxylase. 3. Mitochondrial carnitine transporter. 4. Tricarboxylate transporter citrate. And the answer for the same is 1, 2, and 4. That is malonyl-CoA, acetyl-CoA carboxylase, and tricarboxylate transporter. Now moving on to the next question. Which of the following is not an aneuploidy? The options are A. Down syndrome, B. Patau syndrome, C. Klinefelter syndrome, and D. Bloom syndrome. And again, in the mission videos, it has been taught by Dr. Anko that D. Bloom syndrome is not an aneuploidy. Moving on to the next question. After how many cycles of PCR will we get half the copies of that after 26 cycles? And the options are A. 25, B. 12, C. 13, and D. 27. And the answer for the same is option A. 25. Now moving on to the next question. Phenomenon of cancer cells consuming more glucose because option A. Lactic acid is produced despite presence of oxygen. Option B. Enhanced conversion of glucose to pyruvate. Option C. Increased pyruvate to acetyl-CoA ratio, CoA, that is high NADH to NAD ratio. And option D. Absence of oxygen. And the correct answer for the same is answer A. Lactic acid is produced despite the presence of oxygen. And another question is a table-based question in which it is asked in G6PD. We have to choose the correct option, and the answer is option A. That is, direct bilirubin will remain normal, indirect will rise, and urine urobilinogen will also increase. And the next question is a calculation-based question in which the glycine titration curve was given, and it was asked to calculate or identify the pH at which molecules exist in a zwitterion form. And in the mission videos, Dr. Ankur has even told the formula on how to calculate this particular pH, and the answer for the same is option 6. Option B, that is 6. Which of the following will not be able to take up glucose in absence of insulin? The options are A. Skeletal muscles, B. RBC, C. Brain, and D. Kidney. And the answer for the same is A. Skeletal muscles. Now, moving on to the next question, question 51 of this recall. A patient with hepatosplenomegaly and cherry red spot at the macula. Now, which enzyme deficiency presents with this clinical picture? And the options are A. Sphingomyelinase, B. Hexosaminidase A, C. Glucose-6-phosphate, and D. Galactocerebrosidase. And the answer for the same is option A. Sphingomyelinase. Now, moving on to the next question. Carbon monoxide and cyanide leads to death because they affect following. The options are A. Myoglobin, B. Cytochrome oxidase, C. Hemoglobin, and D. NADH dehydrogenase. Very important PYQ also taught in our mission videos, and the answer for the same is option B. Cytochrome oxidase. Now moving on to the INI-CET OBGY recalls. The question first. According to modified Rotterdam's criteria, which are the criteria for PCOS? Another multi-correct question. The options were obesity, delayed malnutrition, hirsutism, and insulin resistance. And the correct answer for the same is delayed menstruation and hirsutism. That is option 2 and 3 were the correct multi-correct options. Now the next question. Which of the following does not cause fetal bradycardia? Option A. Abruption. Option B. Fetal head compression. Option C. Congenital heart disease. Option D. Maternal fever. And the correct answer for the same is option D. Maternal fever. Now moving on to the next question. The uterine stimulant not to be given in the management of PPH is. So PPH is a very important previous year topic, and it has been taught by Dr. Rana in her mission videos, giving you the whole algorithm according to WHO for the treatment of PPH. So the options were option A, oxytocin, option B, misoprostol, option C, dinoproston, option D, 15-methyl analog of PGF2 alpha. And the correct answer according to the algorithm given in the mission videos as well is option C, dinoproston. A laparoscopic image of a patient with infertility and delayed cycles with free spill on chromoid perturbation was given. What is the probable diagnosis? Option A, endometriosis. Option B, fibroid. Option C, PCOS. And option D, tubo-ovarian mass. And the correct answer for the same is option C, polycystic ovarian syndrome. The next question. A 65-year-old patient presents with an ovarian mass with ascites or mental caking, and USG reveals components in CA125 is 990. What is the probable diagnosis? Option A, mucinous cystadenocarcinoma. Option B, serous cystadenocarcinoma. Option C, endometrial tumor. And option D, granulosa cell tumor. And the correct answer for the same is option B, serous cystadenocarcinoma. Now the next question. All are the uses of magnesium sulfate except. Option A, increases renal perfusion. Option B, neuroprotection. Option C, prevention of seizures. And option D, prevents abruption. And the correct answer for the same is increases renal perfusion. Now moving on to the next question. An asymptomatic 29-year-old pregnant woman presents in the first trimester with urine culture showing E. coli. The most common complication associated with this clinical picture is option A, chorioamnionitis, option B, fetal death, option C, preterm labor, and option D, miscarriage. And the correct answer for the same is option C, preterm labor. Now again a multi-correct or arrange in the correct sequence question. It was asked to arrange the correct sequence of the pap smear and the options were given. The options were lithotomy position, per speculum examination, per vaginal examination, taking samples with IO spatula. And the correct order is first we'll put the patient in lithotomy position, then do per speculum exam, and then take the sample with IO spatula. Per vaginal examination is not a part of pap smear. Now, the next question, which investigation modality is not safe in pregnancy? The first question, the first option A, USG, B, CT scan, C, Doppler, and D, MRI. And the answer for the same question is option B, CT scan. So now moving on to the PSM recall of INI-CET May 2025. The first question is a match of the following question. The one side, the column was tick, mite, louse, and flea, and the another column was epidemic typhus, endemic typhus, RMSF, and rickettsial pox. So the correct match the following goes to tick is RMSF, mite spreads rickettsial pox, louse spreads epidemic typhus, and flea spreads endemic typhus. Now, moving on to the next question, organize the following steps in correct sequence for conducting a research. The option A, conduct data analysis. Option B, selecting population. Option C, setting research question. Option 4, setting the research objective. It was arranged in a correct sequence question, and the correct sequence was first setting, we'll set the research question, then we'll set the research objective, then we will select the population, and at last we'll conduct the data analysis. The next question is a calculation based question in which in a village having 100 children, 10 had developed measles the previous year. Now this year again 20 children developed measles for the first time. What is the incidence rate of measles? And the correct answer according to the formula which is taught by Dr. Vivek in our mission videos in the PSM section is 22.2% if you put the values in the formula given. The next question is which of the following is not a high risk group for HIV? And the options for the same are injection drug users, men having sex with men, commercial sex workers, and long distance truck drivers. And the correct answer for the same is option D, long distance truck drivers. The next question, in a given population of a town, 6,000 were below, another calculation based question, 6,000 were below the age of 15 years. At the same time, there were 2,000 above the age of 65 years. A total of 12,000 were earning members in the town. And we had to calculate the dependency ratio. Again, the formula given in our videos, given in our mission videos by Dr. Vivek. And after replacing the values, we'll get the answer as 0.66, that is option C. Moving on to the next question, we have to find the incorrect combination. A, standard error, variability. B, coefficient of correlation, relationship. C, moments, skewness. D, mean, median, and dispersion. The correct answer for the same is option D. Now you are a medical officer at PHC collecting data for disease burden in your catchment population. You divide the disease-based population into mild, moderate, severe groups, and then few are selected from each group for the study. This is which type of sampling? Option A, simple random sampling. Option B, systematic random sampling. Option C, stratified random sampling. And option D, cluster random sampling. And the correct answer for the same is option C, stratified random sampling. Now, moving on to the next question. The best timings of copper T380A insertion to ensure good compliance under RCH program is another multi-correct question. 1, within 48 hours of delivery. 2, immediately postpartum. 3, within first 7 days of menstrual cycle. And 4, within 7 days of next menstrual cycle. And the correct answer of this for the same is 1, 2, and 3. That is within 48 hours of delivery, immediately postpartum, and within first 5 to 7 days of the menstrual cycle. Now the next question. As per the MTP Act, 2 doctors' opinion is required for how many weeks of POG? And the options are 8 to 12, 16 to 20, 20 to 24, and 12 to 16. And the correct answer for the same is option C, 20 to 24. Now the next question. You are a medical officer at PHC and an infant presents to the OPD with scabies. And now we have to tell the drug of choice. The options are A, ivermectin, B, 10% protamidone, C, 5% permethrin, and D, benzyl benzoate. And the correct answer for the same is option C, 5% permethrin. Now moving on to the next question. Under NHM, RMNCHA strategy has been devised to provide quality healthcare to various vulnerable age groups. Which of the following is a component of RMNCHA strategy? And the options are another multi-credit question. A, adolescent health, B, family planning, C, geriatric health, fourth, maternal and child health, and fifth, infant health. So the correct option is except geriatric health, all of the other are covered in the RMNCHA strategy. Now the next question. Quartiles, tertiles are measures of A, dispersion, B, central tendency, C, locations, and D, correlation. And the correct answer for the same is option C, locations. The legislation responsible for maintaining the data scrutiny of the medical records is HIPAA, option A, option B, DPDP, option C, MTP, option D, PCPNDT. And the correct answer for the same is option B, DPDP. Now moving on to the next question, the question 75 of this INI-Recall. In the Mahakumbh Mela, what was the primary purpose of mobile medical vans having multiple surveillance units for fever, diarrhea, and respiratory illness? The options are option A, to reduce number of health workers and professionals. Option B, for immediate quarantine measures of symptomatic individuals. Option C, for treatment only. Option D, to diagnose with lab tests and give potential warning for early outbreaks of fever, diarrhea, and respiratory infections. So the answer for the same question is to diagnose with lab tests and give potential warning for early outbreaks of fever, diarrhea, and respiratory infections. Now moving on to the next question, which of the following vaccines is not given to a child with SCID? And the options are A, IPV, B, hepatitis B, C, MMR, and D, DTaP. And the answer for the same is option C, MMR vaccine. Now moving on to the next question. According to WHO, blindness is considered as a major health problem, and as per WHO, the definition of blindness is. The options are option A, visual acuity less than 6 by 60 after correction in the better eye. Option B, visual acuity less than 3 by 60 after correction in the better eye. Option C, visual acuity less than 6 by 60 without correction in the better eye. Option D, visual acuity less than 3 by 60 without correction in the better eye. And it has been clearly taught by Dr. Vivek Jain in the mission videos in the PSM that the blindness, the criteria for blindness, the exact question has been taken from the mission videos, that the exact criteria for blindness is less than 3 by 60 in the better eye according to WHO. Now moving on to the INI Pharmacology Recall. The first question, a 62-year-old male with a history of coronary artery disease and renal failure was admitted to ICU with elevated BP and declining urine output. The intensivist administered phenoldiazepam IV. How does this drug help in improving the renal function in this patient? And the options are A, D1 agonism, option B, D2 antagonism, option C, alpha antagonism, option D, muscarinic antagonism. And the correct answer for the same is option A, D1 agonism. Next, which of the following statement regarding thalidomide is false? Option A, it acts as an antimetabolite. Option B, it is a teratogenic drug. Option C, it is used in type 2 Lepre reaction. And option D, it is used in relapsing multiple myeloma. And the correct answer for the same is option A, it acts as an antimetabolite. The next question, which of the following drug is associated with cholestasis without significant portal inflammation? And the options are A, acetaminophen, B, amoxiclav, C, isoniazid, and option D, estrogen plus androgen. And the correct answer for the same is option D, estrogen plus androgen. Now moving on to the next question. Which of the following drugs are used in the clinical cure of malaria? And the options are A, artemether, B, sulfadoxine pyrimethamine, C, chloroquine, and D, primaquine. It is a multi-correct question, and except primaquine, all of the other drugs are used in the clinical cure of malaria. The next question, another multiple correct question. Erythropoietin is primarily used in the treatment of which of the following types of anemia? First, nutritional, B, CKD related, 3, MDS syndrome related, and 4th, aplastic anemia. And the correct answer for the same question is option 2 and 3, that is in CKD related and MDS related anemia, we can use erythropoietin. The next question, Which pharmacokinetic parameters are used to determine the loading dose of an orally administered drug? First, volume of distribution. Second, half-life. Another multi-caret question for that matter. Option 3, plasma concentration. And option 4, bioavailability. And the correct answer for the same is except half-life, all of the following, that is volume of distribution, plasma concentration, and bioavailability are used in calculation of the loading dose of an orally administered drug. The next question. A 28-year-old male with a known history of generalized tonic-clonic seizures is on long-term carbamazepine therapy. What is the most likely explanation for his symptoms? Option A, refractory seizure due to pharmacodynamic resistance. Option B, carbamazepine toxicity due to drug interaction. Option C, erythromycin toxicity due to enzyme induction. Option D, decreased absorption of carbamazepine leading to subtherapeutic levels. And the correct answer for the same is option B, carbamazepine toxicity due to drug interaction. Now moving on to the next question. So as you can see clearly, Dr. Govind Rai Garg has taught this beautifully in the mission videos of cerebellum that the phase 1 reaction is used to introduce or expose functional groups for further metabolism, which is the correct answer. That is the option C in this particular question. Now moving on to the next question, the question 86 for this recall. Which of the following statements about barbiturates and benzodiazepines is correct? Statements are: both act on GABA chloride channels. B. Flumazenil is antagonist of barbiturates. C. Benzodiazepine increases the duration of chloride channel opening. D. Barbiturates are used to treat acute anxiety. And the correct answer for the same is both act on GABA chloride channels. Option A. Match the following question. The column 1 includes hepatitis B vaccine, veterinary drugs, morphine, and insulin. The option B includes Schedule X, Schedule H, Schedule G, and Schedule Z. So the correct answer for the same is hepatitis vaccine is under Schedule G. Veterinary drugs are under Schedule Z. Morphine is under Schedule X, and insulin is under Schedule H. Now the next question: which of the following statement is true regarding the pharmacological relationship between imipramine and dihydrophenhydramine? Option A, imipramine inhibits diphenhydramines action. B, diphenhydramine inhibits imipramine's action. C, both block muscarinic receptors. D, both are norepinephrine reuptake inhibitors. And the correct answer for the same is option C, both block muscarinic receptors. And it is a similar question discussed by Dr. Govind Rai Garg in the mission videos as well. A question similar which has been asked in this INI only. So now moving on to the next question. The INI-CET Ophthalmology Recall for INI 2025. The first question is: all of the following are used in the treatment of amblyopia except, and the options are A, strabismic surgery, B, video games, C, patching, and D, refractive error correction. And the answer for the same is option B, video games. Now moving on to the next question. An image was given and the diagnosis was asked. The image is shown in the PPT, and the options are A, intranuclear ophthalmoplegia, B, ophthalmoplegia. Now moving on to the next question. Type of retinal detachment seen in uncontrolled diabetes is A, rhegmatogenous, B, tractional, C, executive, and D, none. And the answer for the same is option B, tractional. The next question. Tests done for all layers of retina are: option A, perimetry, option B, optical coherence tomography, option C, fluorescence angiography, and option D, ultrasound B scan. The correct answer for the same is option B, optic coherence tomography. Now moving on to the next question. Corneal transplant image was given and it was asked about the storage medium and suture used. And the options are McCarry-Kaufman medium, 10-0 nylon monofilament suture, McCarry-Kaufman medium and vicryl suture. Option C, moist chamber and silk suture. Option D, ethylene glycol and vicryl suture. And the correct answer for the same is option A, McCarry-Kaufman medium and 10-0 nylon monofilament suture. Now moving on to the next question. After cataract surgery, the patient presents with flare cells in the anterior chamber after 2 weeks, and it is asked about what's the condition and which organism is responsible. And the options are: option A, endophthalmitis and Propionibacterium acnes, option B, endophthalmitis and Streptococcus, option C, endophthalmitis and mucormycosis, option D, toxic anterior shock syndrome and Streptococcus. The correct answer for the same is option A, endophthalmitis and Propionibacterium acnes. Now moving on to the surgery recall. The first question is: which of the following is not included in the T4B stage of breast cancer? The options are ulceration, Satellite nodules, skin erythema, excoriation more than one third, and powder orange appearance. It has been clearly taught by Dr. Amrit Nasta in his mission videos the staging of the breast cancer according with what all the criteria are included in T4B. And the correct answer for the same is option C, erythema excoriation more than one third. Now moving on to the next question. Which of the following is not a contraindication to breast conservation therapy? The options are prior chest radiation, involved margins after resection, C. Scleroderma, and limited to one quadrant. And the correct answer is option D, limited to one quadrant. Now, the next question. Which of the following is or are correct statements about back? Another multi-correct question, and the options are reduces bacterial load, maximum pressure is negative 125 mm of Hg, C promotes healing of tissue, and D reduces size of wound. And the answer is all the above options are correct. Now moving on to the next question. Incision, we have to, the image was given and the procedure was asked. And the options are A, incision and drainage of abscess. Option B, skin grafting. Option C, keloid excision. And option D, dog ear correction. And the correct answer for the same is option D, dog ear correction. Now the next question. Patient with a history of chest trauma with breathlessness on examination is found to have a systolic BP of 90 mm Hg, SpO2 of 85%, and GCS 8 by 15 with absent breath sounds. What is the next step? The options are A. Secure airway, needle thoracotomy, and IV fluids. Blood transfusion and send for CT. Then take history, administer IV dextrose and send for EFAST. And then CT scan of head and airway securing. The correct order and the correct answer is secure airway, needle thoracotomy, and then go for IV fluids. Now moving on to the 100th question of this INI recall. A 20-year-old female with fever, nausea, rebound, tenderness with the migration of pain to the RIF and raised TLC of 15,000. What is the Alvarado score? And the same score has been taught in the mission videos as well. And the correct score after putting the values is the answer is 6. But if the tenderness is given in the right iliac fossa, it gets a point, it gets double points and the answer changes. So the next question. Which of the following is incorrectly paired? A. Chronic pancreatitis, Mannheim score. Eclasia, LA classification. Colonoscopy, Boston score. And parathyroid dissection, Miami criteria. The correct answer is option B, Eclasia, LA classification. The next question. What is incorrect about tension pneumothorax? Options are A. Improper dressing of an open chest wound can lead to tension pneumothorax. Simple pneumothorax can never become tension pneumothorax. Option C. It can commonly occur after mechanical ventilation with positive airway expiratory pressure. Option D. Severe chest trauma with fractures can lead to it. And the correct answer for the same is option B. Simple pneumothorax can never become tension pneumothorax. The next question. Female presents with bleeding PR and ulcerated mass is felt 6 cm from the anal verge. Tumor shows intramucosal carcinoma and the stage of that cancer was asked. And the correct answer for the same question is option D, that is 0. The next question. The image was given and the bariatric surgery was asked. And the options are A. Sleeve gastrectomy, B. SADI sleeve, C. BPD, and D. DS. The correct answer for the same is option B. SADI, that is single anastomotic duodenal inversion with sleeve gastrectomy. The next answer is a calculation based question in which the area of burn was asked, in which a female suffered burns onto the face with singeing of eyebrows, bilateral upper limbs, and front of the chest. By putting onto the rule of 9, the answer comes out to be option A, that is 27 to 30%. The next question is which of the following is not a boundary of hepatocystic triangle? And the options are cystic duct, cystic artery, common hepatic duct, and inferior border of liver. And the correct answer is cystic artery. The next question is what is Z-plasty used for? And the options are technique for scar lengthening, technique for pedicle fab creation, zigzag suture technique, and technique for giving injection. And the answer is option A, technique for scar lengthening. The next question. Which colloid is used in resuscitation as per Muir and Barclay's formula? And the option are PRBC, FFP, albumin, and dextran. And the correct option is option C, albumin. The next question is a fact-based question. Imminent gangrene in PVD occurs when ABPI, that is the ankle brachial pressure index, is. Options are 0.9, 0.7, 0.5, and 0.3. And the correct answer is option D, 0.3. The next question. Recurrent urinary stones occur in all of the following situations except. And the options are hypercalciuria, hyperoxaluria, hyperuricosuriya, and hypercitrullinuria. And the correct answer for the same is option D, hypercitrullinuria. Now going on to the pathology recall for INI May 2025. And the first question is, which of the following is the most common inherited bleeding disorder? And the options are von Willebrand disease, B. DIC, C. Factor V deficiency, and option D. Hemophilia. And the correct answer for the same is von Willebrand disease. Now moving on to the next question. Which of the following HPV serotypes are commonly associated with cervical carcinoma? And the options are HPV 16 and 18, HPV 6 and 11, HPV 1 and 5, and HPV 31 and 33. And the correct answer is HPV 16 and 18, that is option A. Now moving on to the next question. Caspase 1 is primarily involved in which type of programmed cell death? And the options are A. Apoptosis, pyroptosis, C. Necroptosis, and D. Necrosis. And the correct answer, as taught by Dr. Sparsh Gupta in the mission videos as well, the whole process of pyroptosis has been taught. The correct answer is pyroptosis. The next question, an image was given and the most likely tumor, a thing associated with this tumor was asked, and the options are elevated CA1. Next option is stromal tumor. Next option is elevated AFP, and the last option is elevated beta HCG. And the correct answer for the same is option B, stromal tumor. The next question is, which of the following renal histological features is characteristically seen in diabetic nephropathy but not typically seen in another glomerulonephritis? Option A is KW lesion, Armani lesion. Option B is mesangial sclerosis. Option C is GBM thickening, and option D is foot process thickening. Cut. And option D is foot process effacement. And the correct answer for the same is option A, Kimmelstein-Wilson lesion, Armani lesion. The next question, in which of the following immunodeficiency disorders is HLA mismatch transplant rejection least likely due to the absent or severely impaired human immune response? The options are Shediac-Higashi, Viscod-Aldrich, Bayer lymphocyte syndrome, Job syndrome. And the correct answer for the same is option C, Bayer lymphocyte syndrome. The next question is, features of Turner's are all except option A, prominent occiput, option B, short fourth metacarpal, option C, webbed neck, option D, wide spaced nipples. And the correct answer for the same is option A, prominent occiput. Now moving on to the next question. Patient has a history of ITP and the treatment was asked. And the options are A, IVIG, B, methotrexate, C, aspirin, and D, bone marrow transplant. And the correct answer for the same question is option A, IVIG. Now moving on to the physiology recall. The first question in physiology, which of the following pulses is based on the Frank-Starling law? The correct options are A, pulsus bisvarians, B, pulsus paradoxus, C, pulsus alternans, and D, pulsus parvus. And the answer is pulsus alternans due to changing ventricular filling volumes. The next question is, what is seen in Bezold-Zarisch reflex? Another multi-correct option. And the options are hypotension, bradycardia, hypertension, tachycardia. And the correct options seen in the Bezold-Zarisch reflex are hypotension and bradycardia. The next question is, which of the following is seen at high altitude? The options are respiratory alkalosis, respiratory acidosis, metabolic alkalosis, and metabolic acidosis. And the correct answer for the same is option A, respiratory alkalosis. The next question, surface tension in alveoli is increased during. The options are A, inspiration, B, expiration, C, stands from supine position, and D, goes from standing to supine position. The correct answer is A, inspiration. The next question, a patient is asked to close his eyes and then reopen them. Then which of the following ECG waves would a decrease, which of the following ECG waves would show a decrease upon the eye opening? And the options are alpha wave, theta wave, beta wave, and delta wave. And the correct answer is alpha wave. The next question, which of the following is an example of a feed-forward mechanism? The options are vasoconstriction after exposure to cold, increase in heart rate on standing from supine position, increase in cardiac output in response to anemia, and temperature regulation. And the correct answer is option D, temperature regulation. Now moving on to the next question. FEV by FVC was given 0.62, FVC was less around 80%, and RV by TLC was 142%. And the age of the patient was 42. And we were asked to diagnose the correct condition. And the options were A, restrictive, B, reduced compliance, C, air trapping, and D, age related. And you can see in the mission videos as well, it has been taught in a beautiful tabular pattern by Dr. Pooja Nigade in her mission videos of physiology as well. And the correct answer is option C, air trapping. Now moving on to the next question. Which of the following is not a mechanism of action of antidiuretic hormone? The options are increase absorption of urea in medullary collecting duct, increase absorption of urea in descending loop of Henle, decrease absorption of NaCl in the ascending loop of Henle, and increase water permeability in the collecting ducts. And the correct answer is increase absorption of urea in the descending loop of Henle. That is option B. The next question, which of the following best explains the development of hyponatremia in a hypovolemic patient with diarrhea? The options are decreased reabsorption of sodium from kidney, decreased secretion of aldosterone, non-osmotic release of ADH, and decreased sodium absorption from intestine. And the correct answer is option C, non-osmotic release of ADH. Now the next question, which of the following brain regions is primarily associated with the processing of explicit memory? And the options are hippocampus, amygdala, insular cortex, and prefrontal cortex. And the correct answer for the same is option A, hippocampus. Now the next question, IGF-1 and IGF-2 are similar to which of the following molecules? A. Insulin, B. Proinsulin, C. C-peptide, and D. Pre-proinsulin. The correct answer for the same is B. Proinsulin. Tight junctions are located at which part of the cell? And the options are A. Apical, B. Apicolateral, C. Basal, and D. Basolateral. And the correct answer for the same is option B. Apicolateral. The next question, what is the tetanizing frequency? A calculation based question. If the contraction period is 40 milliseconds, and by applying the formula, we get a correct answer of option C, 25 Hz. Now the next question. The center which causes fever during infection is paraventricular nucleus of hypothalamus, dorsomedial nucleus of thalamus, amygdala, or cerebellum. And the correct answer is dorsomedial nucleus of thalamus. Now moving on to the pediatric recall of INI May 2025. The first question is, baby cannot sit without support but can roll and say mama, dada. Stranger anxiety is also present. What should we do next? A. Reassurance as dysmus variation is common. B. Get development test. C. Give training to sit. D. Get an MRI. And the correct answer is option A. Reassurance as dysmus variation is common. Now the next question. Which of the following condition best explains a malnourished kid who was given food and he developed hypophosphatemia, hypomagnesemia? The options are mechanism of refeeding syndrome, low insulin mediated uptake of electrolytes, urinary loss of phosphate, and none of the above. And the correct option is option A, mechanism of refeeding syndrome. The next question, a child with non-bilious vomitings 3 weeks after birth but normal abdominal examination. And what is the correct answer? And the options are GERD, CHPS, that is congenital hypertrophic pyloric stenosis, C. Cow milk protein allergy, and D. Doctor intestine cut, and option D. Intestinal obstruction. The correct answer for the same is option B. Congenital hypertrophic pyloric stenosis. Now the question is about the breast milk jaundice. Which of the following is true regarding the mechanism? A. Unconjugated hyperbilirubinemia, B. Late onset, C. Beta glucuronidase enzyme involved, and D. All of the above. And the correct answer is option D. All of the above, and which has been taught by Dr. Anand Bhatia in his mission videos in pediatrics as well. Beautifully taught breastfeeding jaundice, and the direct question came into the INI as well. Tetralogy of Fallot, which of the following is not a component? The options are A. AHD, LVH, B. Pulmonary stenosis, C. Overriding of aorta, and D. RVH. And the correct answer is option A. AHD and LVH. The next question, 36-weeker newborn and breathing difficulty, X-ray was given and FiO2 was 30% and improved with an FiO2 of 30%. What is the diagnosis? A. Hyaline membrane disease, B. Transient tachypnea of newborn, C. Meconium aspiration syndrome, and D. None of the above. And the correct answer was option A. Hyaline membrane disease. Now the next question. A patient with sudden onset headache, photophobia, vomiting, neck stiffness, and brilliancy sign positive. Images shows hydrocephalus without hemorrhage. What is the likely diagnosis? The options are NPH, viral encephalitis, bacterial meningitis, and subarachnoid hemorrhage. The correct answer is bacterial meningitis. The next question. Which of the following is not true regarding marasmus in a child? Option A, seen due to caloric deficiency, carbohydrate deficiency. B, protein loss is responsible for edema in this patient. C, subcutaneous fat is preserved. D, associated with severe hypoalbuminemia. So now, moving on to the Orthopedics Recall for INI May 2025. The first question, which tumor is associated with Codman's triangle and sunburst appearance? And the correct answer for the same is option A, osteosarcoma. Now the next question, According to WHO, which investigation is included in the diagnosis of TB spine? And the options are X-ray, CT scan, CBNAT, culture, and sensitivity. And the answer for this question is option C, CBNAT. The next question is, what is the preferred treatment for an intertrochanteric fracture in a 72-year-old female? And it has been beautifully taught by our doctor Apoor Mehra in his revision video that the treatment for the intertrochanteric fracture in an old female is intramedullary nailing. That is option B. You can see in the mission videos, it has been beautifully explained by the images as well. The next question, a laborer falls on an outstretched hand and complains of pain in the anatomical snub box. Which of the following is the most appropriate next step? And the options are NSAID and discharge, MRI of wrist, thumb spica cast and follow up after 10 to 14 days, and CT scan of the wrist. And the correct answer for the question is option C, thumb spica cast and follow up after 10 to 14 days. The next question, a patient with a rheumatoid arthritis presents with neck pain and clinical signs of myelopathy. What is the most likely question? Again, a question directly from the mission videos. The options are A, osteoarthritis of vertebra, B, C2, C3 intervertebral stenosis, C, atlantoaxial dislocation, D, disc herniation. And the correct answer is option C, atlantoaxial dislocation. Now moving on to the medicine recall for INI. The first question is, the following is one of the earliest presenting symptom in a patient with MS. The options are sensory disturbance, ataxia, vertigo, and facial palsy. And the correct answer is option A, sensory disturbance. Now moving on to the next question. Mitral stenosis murmur corresponds to which wave of the ECG? And the options are QRS, T wave, P wave, and ST segment. And the correct answer is option C, P wave. Now moving on to the next question. A 20-year-old female diagnosed with septic shock presents with a BP of 58 to 30 after receiving 3 liters of crystalloid fluid. Her mean arterial pressure remains 58 mmHg. What is the next best step in management? And the correct answer is to start noradrenaline, that is option B. A 62-year-old male patient presents with sudden onset of shortness of breath, bilateral pedal edema. He is with his hypertensive medication and BP is well controlled. Echo reveals an ejection fraction of 60%, concentric LVH, left atrial enlargement, and grade 2 diastolic dysfunction was noted. What is the most appropriate next step to improve the condition? And the correct answer for this question is initiate loop diuretics and SGLT2 inhibitors for the management of heart failure with preserved ejection fraction. That is option B. Now the next question. A 65-year-old known case of Parkinson disease presents with recurrent oropharyngeal dysphagia and recurrent episodes of aspiration pneumonitis. Complaints of excessive respiratory secretions. Chest imaging reveals bilateral bronchiectasis. What is the most appropriate long-term management for the patient? And the options are high-frequency chest wall oscillation therapy, NACE to reduce secretions, that is nebulization of N-acetylcysteine, PEG tube placement, and macrolide therapy. And the correct answer for the same is option C, PEG tube placement. The next question is, a 56-year-old patient presents with complicated UTI and is found to have hypotension. His blood pressure does not improve with IV fluids. Which of the following is the most appropriate antibiotic to manage his conditions? And the option is amoxiclav, nitrofurantoin, meropenem, and ceftriaxone. And the correct answer for the same is meropenem. The next question, a patient with lupus nephritis with abrupt rise in creatinine, renal biopsy shows wire loop lesions, and the best treatment option is A, mycophenolate mofetil, B, rituximab, C, high-dose corticosteroids, and D, corticosteroids with cyclophosphamide. And the correct answer is option D, corticosteroid with cyclophosphamide. The next question, question 155, a 58-year-old male presents to a PHC for a routine checkup. His BP readings on two separate occasions are 148/90, 152/96. He is asymptomatic and has no known comorbidities. What is the most appropriate next step according to the current hypertension guidelines? And the correct answer for the same is option B. Start amlodipine 5 mg once daily and advise follow-up in 1 month. The next question is, wrong statement for lumbar puncture is. And the correct answer for the same question is, can be done in thrombocytopenia, that is counts less than 10,000. Now the next question 160. Patient of multinodular goiter, excess iodine causes thyrotoxicosis. What is the phenomenon called? And the options are A, Jod-Bezdow, option B, Wolff-Chaikoff, option C, Pemberton's. And the answer for the same is option A, Jod-Bezdow. The next question, the 161st question of this recall is, which of the following is false regarding bempedoic acid? And the correct answer for the same is option A. It is a non-competitive inhibitor of ATP citrate lyase. The next question is, which of the following is the most common clinical feature observed during the progression of systemic lupus erythematosus? And the options are photosensitivity, nephrotic syndrome, arthritis and arthralgia and myalgia, and option D, anemia and thrombocytopenia. And the correct option, as even stated in our revision cut, and the correct option stated even in our mission videos is option C, arthralgia and myalgia. The next question, obesity not associated with cancer. And the options are meningioma, pancreatic cancer, stomach cancer, and multiple myeloma. And the correct answer for the same is option C, stomach cancer. And now the next question. Now going on to the FMT recall for INI. The first question is, as per 116 BNS, which of the following is not a grievous hurt? The options are severe pain for 5 days, broken tooth, elbow dislocation, and emasculation. And the correct answer is option A, severe pain for 5 days. The next question is, the Marshall triad of bruise, abrasion, laceration is seen in which type of injury? And the option is RTA, bomb blast injury, strangulation, and firearm injury. And the correct answer according to this question is option B, bomb blast injury. The next question is, match the following in which the column A was organic irritant, metallic irritant, deliriant, depressant, and the column B was opioid, croton, cocaine, and lead. And the correct matching was organic irritant was croton, metallic irritant was lead, deliriant is cocaine, and depressant is opioid. The next question, wrong statement with respect to snake bite is. And the correct answer is that cobra bite is myotoxic is the wrong statement. Rest statements like viper bite is vasculotoxic, cobra belongs to Elapidae, and most snake venoms contain hyaluronidase are correct. The next question, a lady comes with a daughter to the hospital with alleged history of rape of daughter. Mother says the daughter age is less than 18 years, but doctor doesn't agree. Which X-ray will help to prove if the age of daughter is more than 18 according to the epiphyseal fusion? The correct answer is option C, wrist, medial end of clavicle, and sternum. The next question, a child with chronic mercury poisoning, which of the following finding will be found? The options are lead line on bones, Danbury tremors and neuropsychiatric features, Mees line, and basophilic stippling in RMCs. And the correct answer is Danbury tremors, neuropsychiatric features. That is option B. Next question. Minimum age for MTP is, options are A, 16 years, 18 years, 20 years, and option D, 25 years. And the correct answer for the same is option B, 18 years. Now the next question, gastric aspirate turns black with AgNO3 in which poisoning? And the options are A, aluminium phosphide, B, mercury, C, lead, and D, phosphorus. And the same question was taught by Dr. Atul Gupta in the mission videos of FMT, that the same question, and the correct option was option A, aluminium phosphide. Now coming to the anatomy recall. The first question is, which of the following is the action of the muscle marked with an arrow in the image? And the options are A, medial rotation of hip, option B, extension at hip, option C, abduction of hip, option D, flexion at knee. And the correct answer is option B, extension at hip. The next question, which muscles are supplied by superficial peroneal nerve? Options are peroneus brevis, peroneus longus, peroneus tertius, and extensor hallucis longus. It is a multi-correct question, and the correct answers are A and B, peroneus brevis and longus. The next question is, which of the following is the function of the muscle attached at the point? The options are elevation. The image was given, and the options are elevation, depression, retraction, and rotation. And the correct answer is option B, depression. Now moving on to the next question, which of the following muscles are supplied by the deep branch of the ulnar nerve? It was a multi-correct question, and the answers are fourth lumbrical, dorsal interossei, and adductor digiti minimi. The next question, a histological photo was given, and it was asked to identify the mark structure, and the answer was bronchus. The next question, how does the mark cell, an image was given, a histological image was given, cells affect the nearby cells? And the option was A, portal vein, B, paracrine, C, transformation from epithelial to mesenchymal, and D, nerve mediated. And the correct answer is option B, paracrine. So here we have also attached the timestamps from our own mission videos which have been recorded prior to the INI-CET, and I'm happy to announce that around 80% of the questions have been asked directly from the mission videos without counting from ENDs, TNDs, and revision videos, main videos as well. So if we count these videos, these ENDs, TNDs as well, we'll be able to reach around 90% of the questions directly from the cerebellum. So it was a great strike rate for us, and also I'm happy to announce that the INI mock, which was conducted by Cerebellum, it was more or less similar to the actual INI because it contained questions like multiple option correct questions. multiple choice questions, match the following questions, and it was more or less similar to the actual INI, a great simulator for the exam, and overall we had a great strike rate in this INI. So now moving on to the next question. Which dental numbering system is represented by the given layout? The image was given and the options are A. Palmer's notation, B. Universal system, C. FDI formula, D. Header-up system. And the correct answer for the same is option A. Palmer's notation. Now the next question, we have to identify the investigation and the image was shown. The options are X-ray difficography, MR difficography, barium swallow, barium enema. And the correct answer for the same is X-ray difficography. Now, a clinical vignette was given with the history of sepsis and the use of procalcitonin was asked. And the options are: can help differentiate fungal from bacterial infection, used to decide the duration of treatment, used to decide the type of antibiotic, used to check the response of the antibiotic. And the correct answer for the same is option B, used to decide the duration of antibiotic. And now the next question. Which of the following is not a symptom of congestive heart failure? And the options are right hypochondriac pain, non-pulsatile elevation of JVP, tamponade, and paroxysmal nocturnal dyspnea. And the correct answer for the same is non-pulsatile elevation of JVP. Now the next question. An image was given and ring enhancing lesion was there with scolex. And the options were brain abscess, METS, tuberculoma, and neurocysticercosis. And the correct answer for the same is neurocysticercosis. Now the next question, which of the following statements about MS is incorrect? 70% of patients with MS develop optic neuritis during the course of illness. Oral steroids are given for acute relapses. Loss of color perception and depth perception is proportional to visual loss. Examination of fundus can be normal and can show papillitis as well. And the correct answer is option C, that is, loss of color perception and depth perception is proportional to visual loss. Now, an image was given and gross photo was given and we were asked to identify the true statements. And the options are A. Sex cord stromal tumor, B. Carl external bodies are present, C. Inhibin positive, and D. CA125 positive. And the correct answer for the same is that statement A, B, and C are correct. So that is the question which is recalled by the students who have given the exam, and we are not exactly sure about the options and the exact clinical stem which was given in the question. The next question, a pregnant lady, a history of recurrent abortions, is now diagnosed to have APLA syndrome. What is the best mode of treatment? The options are aspirin, aspirin plus steroids, aspirin plus heparin plus steroids, and aspirin plus heparin. And the correct answer is aspirin plus heparin. Now the next question. A 24-year-old woman presents with a breast lump. Her mother died of breast cancer at 31 and only one genetic mutation test can be performed. Which of the following genes should be tested first? The options are BRCA1, PTEN, TP53, and CDH. And the correct answer for the same is BRCA1. Now the next questions, GnRH antagonist uses were asked multiple choice questions and the options were advanced prostate cancer, male hypogonadism, hypogonadotrophic hypogonadism, controlled ovarian stimulation in IVF, and tocolysis. And the correct answer for the same is it is used in advanced prostate cancer treatment and controlled ovarian stimulation in IVF. Now the next question, some question regarding nerve graft was asked and true and false was asked to identify which statement is true and which statement is false. And the options were it is used for peripheral nerves, facial palsy, anterior introitious great saphenous nerve, or fibrin glue, something like that was asked. We don't correctly recall the question, and this is the recall which we got. Now the next question, which of the following statements regarding breastfeeding technique is or are correct? The infant's lower lip should be inverted. The infant cheek should appear full during feeding. Upper areola should be covered more than lower. The infant chin should touch the breast, and the correct answer for the same are infant cheek should appear full during feeding and upper areola should be covered more than lower. These are the correct statements. Now, which of the following stains is not used to identify organisms in post-renal transplant patient? The options were gomorimethamine, Mason Fontana, PAS, and Congo-Red. And the correct answer, and histopathological image was also given, and the correct answer for the same is Congo-Red. Now the next question. Which of the following statements is false regarding gene cancer associations? And the options are STK11 breast cancer, BRCA2 prostate cancer, TP53 mucosal neuromas, PTEN thyroid lesions. And the correct answer for the same is option C, TP53 mucosal neuromas. Now some statement regarding free radicals were given and it was asked to identify the incorrect one. And the options are A, lipid peroxidation, B, SOD inactivates it, C, produced by neutrophils, and D, fibrinoid necrosis. And the correct answer for the same is D, fibrinoid necrosis. Which of the following is true about post-dural puncture headache? 4 statements were given and we were asked to identify the incorrect one. more commonly seen in elderly females. Lumbar puncture must be done in suspected SCH even if the NCCT is normal. Meningitis after lumbar puncture is an unusual complication, and lumbar puncture is contraindicated in thrombocytopenia. And the correct answer for the same is more commonly seen in elderly and female. And there were some incomplete questions as well. Best for multiple mutations at different sites, like karyotyping was the option, exome sequencing, fish, Sanger sequencing, and the correct answer for the same is exome sequencing. Highest transmittability as pregnancy advances, and the options are rubella, parvo, toxo. And the correct answer for the same is option C, toxoplasmosis. Some question regarding chronic osteomyelitis, some clinical stem was given, and it was asked which organism causes it, like Klebsiella, something like that. Like the question is not recalled correctly. And some question regarding cross tolerance, reverse tolerance was there, match the following kind of a question, and we don't recall the correct question or the options as well. So considering this INI was moderate to tough, like, and similarly, like other INIs, many questions were from previous year topics, only a single line or a few options were changed. And the question was twisted, but the topic was same. So I again encourage you to revise previous year questions, previous year topics for which we at Cerebellum are providing you the late night modules and midnight modules consisting of PYQs and PYTs, and also many questions were directly from the mission videos as well. So I'll highly encourage you to revise again and again so that the things get consolidated in your mind and you will be able to score a good rank in NEET PG. And so that's it from my side, and thank you and all the best for the upcoming exams.